Podcast 3, Week 5. Welcome to the podcast, Your Pregnancy Week by Week. This podcast covers the 40 weeks of pregnancy in 38 segments and is based on the book Your Pregnancy Week by Week by Dr. Glade Curtis, MD, and me, Judith Schuler, MS. The information in our books and podcasts is a general informative guide about pregnancy. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctor. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your pregnancy concerns, questions, or interests into words. The goal of every pregnancy is a healthy mom and a healthy baby. To that end, our podcasts cover many topics. In each weekly podcast, we'll highlight information contained in the same weekly discussion in our book. We suggest you read each weekly chapter to learn further information, such as how baby is growing and changing and how you're growing and changing too. Our book also contains illustrations of changes in baby or you, advice for dads, charts, lists, boxes, an exercise for every week, a comprehensive glossary, hints, tips, snippets, and blurbs we just can't reproduce in a podcast. So let's get started on this week's discussion. We're going to look at Week 5. Today's home pregnancy tests are very sensitive, which makes early diagnosis of pregnancy possible. Over-the-counter tests are very reliable. Even pregnancy tests at the dollar store have proved accurate. Some pregnancy tests can be positive, indicate pregnancy, as early as 10 days after conception. Once you have a positive pregnancy test, call the doctor's office to set up your first prenatal appointment. Good prenatal care is a must for you and baby. Are you experiencing nausea and/or vomiting? It can be an early symptom of pregnancy for some women and is called morning sickness. Nearly half of all pregnant women experience nausea and vomiting, and about 25% have nausea only. Morning sickness can occur at any time of day. It usually begins around the 6th week of pregnancy and improves and disappears around week 13. Is there treatment for morning sickness? Unfortunately, there is no completely successful treatment. Don't take anything on your own. Call your doctor's office and talk with them. Ask about the various treatments they recommend. Acupressure, acupuncture, and massage have helped some women. Acupressure wristbands can also help some women feel better. This is an extremely important period in the development of your baby. Don't use herbs, over-the-counter treatments, or any other remedies you hear about without checking with your doctor first to see if they're safe. They may not be. You may have heard marijuana is okay to treat morning sickness. It's not. Marijuana use may have very negative effects on baby. There are things you can try to help you deal with morning sickness. Eat small meals more frequently. Eat what appeals to you. Ginger is great for many women. Eat it fresh or make a tea with it. Drinking spearmint and peppermint teas may also help, but don't drink more than 1 or 2 8-ounce cups of tea in any given day. Drinking more than that may cause problems. Try hard candies and suckers made to deal with morning sickness. Many contain ginger. Keep up your fluid intake, even if you can't keep food down. If you vomit a lot, take good care of your teeth. Brush them often. Beyond normal morning sickness, severe morning sickness may be a problem for some women. It's called hyperemesis gravidarum. If you experience severe nausea and vomiting, if you can't eat or drink anything, or if you feel so ill you can't carry on daily activities, call your doctor. In severe cases, a woman may need to be treated in the hospital. Hypnosis has been used successfully to treat the problem. A few women experience symptoms beyond baby's birth that can take months to go away. This is called postpartum hyperemesis gravidarum. Recovery can take a few months to as long as 2 years. If hyperemesis gravidarum persists after baby's birth, you may need further help from your doctor. You may notice some other changes as you travel down the pregnancy road. You may need to urinate a lot. Your sense of smell may change. You may notice your breaths are changing. And you may feel so exhausted right now that you can hardly get out of bed. Don't worry, they're all part of being pregnant. Your nutrition is important when you have morning sickness. In addition to eating small meals frequently, find out what foods, smells, or situations nauseate you. Avoid them. Eat foods you can tolerate. Expecting dads can also experience physical problems during pregnancy. It's called kuvad. A dad-to-be may experience some or many of the pregnancy symptoms a mom-to-be does. I want to address a life-threatening pregnancy problem that can occur in the first trimester, ectopic pregnancy. The word ectopic actually means out of place. With an ectopic pregnancy, the fertilized egg implants outside the uterine cavity. A woman may have symptoms similar to a regular pregnancy, or she may not have any recognizable signs of pregnancy at all. If she has an ectopic pregnancy, other symptoms can develop. Ultrasound testing is helpful in diagnosing an ectopic pregnancy. The best test for diagnosis is laparoscopy. It's important to diagnose the problem before it ruptures and damages the tube. Early diagnosis also tries to avoid the risk of internal bleeding. A woman cannot carry an ectopic pregnancy to term. The pregnancy must be removed, usually with surgery. Remember, our podcasts give you the highlights of what may be happening in any given week. Check our book, Your Pregnancy Week by Week, for more detailed information. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. It covers pregnancy from a man's point of view and provides lots of valuable information a man may find very useful. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topics list. It details topics covered in each podcast, so you can listen to a particular podcast or read a certain chapter week if you want more information, or if you want to check out something you missed or a topic we haven't covered yet.